All right, good afternoon, everybody. I'd like to call the Salary Board meeting to order. Would everyone please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, may I have a motion to approve the minutes from our last Salary Board meeting?
Motion.
Second.
Been a motion and a second on the question. All those in favor signify by saying aye.
Aye.
Aye. Opposed? The ayes have it, and the minutes have been approved. Opportunity for the public to address the board on agenda items only. Okay, seeing that there is no one, we'll go into the motions. And this is under Human Services. Motion 24-4028. May I have a motion to change the title of the vacant Community Health Nurse Administrator 2 to Community Health Nurse at a salary of $50,000?
Motion.
Second.
It's been a motion and a second. On the question, we have Acting Director of Human Services and Executive Director of Drug and Alcohol, Barbara Durkin, to speak on this.
Sure. Thank you, Commissioner.
And Barb, if you want to just go through all of it at once and just talk about all the changes instead of...
Yeah, that's fine. So we have a number of changes that we're presenting here today. Many of them are in relation to the new positions that will fall under the Department of Human Services from the previous Department of Health. So obviously, we no longer are having a Department of Health here in Lackawanna County because it fiscally didn't make sense. We still want to move forward with employing many of the individuals who were part of that Department of Health in other such human service roles that will assist not only with the Office of Youth and Family Services, but all of the human service departments here in Lackawanna County. We're looking to create positions as community health navigators, which will be really connecting families and individuals in the county to appropriate services so that we're not flooding the child welfare system with cases that don't necessarily need a dependency or child welfare involvement. So we're looking to create, we're also looking to continue to employ some of the community health nurses that we had through the Department of Health. So that's where this one comes into play. And then we're obviously looking to create a program manager because, you know, we have a lot of people that we're looking to retain from the Department of Health to do this work. We need someone who has experience with not only those individuals, but the public health work. So we have a program manager that we would love to bring on at the salary of $65,000, which we think is fair. And then obviously the community health nurses we're looking to hire at the salary of $50,000. And we've had many interests from previous Department of Health workers in these positions. And then we're obviously looking to create the navigator positions at the salary of $40,000. So again, we know that the Department of Health, from a financial perspective, we weren't quite sure what that would look like for the county, but there are other reimbursement structures for programs underneath a Department of Human Services. So that's why we're comfortable moving in this direction with these positions.
Yeah, that was one question while you were talking, I was thinking about. So I knew we were going to get reimbursements for the health department, so you'll get reimbursements for all of these positions?
So it won't be 100% reimbursement, but it will be better than what the reimbursement was projected for the Department of Health. So typically, if for human service, if we're going to say contract with the Office of Youth and Family Services and the state would be funding some of these programs that we're looking to implement, it would be like an 80% state reimbursement and a 20% county reimbursement, which is much higher than what we were projecting for the Department of Health.
Okay.
And just to add on to that point, too, I had asked Kathy Snyder, who's the fiscal
officer for the Office of Youth and Family Services.
And she confirmed that these new positions would be reimbursed by the state 80%. So the total cost to the county would be $242,707.36. And that's after the 80% reimbursement. And that's the grand total from June 2024 to June 30th, 2025.
Correct, that's accurate. And there are other reimbursement structures that we could look at based on these job responsibilities, such as reimbursement through the Medicaid program as well. So we have other opportunities that we didn't otherwise have.
Okay.
Yeah. Do you want me to speak on the part-time Office of Youth and Family Service workers as well? Do you want me to add them in there?
Yeah, sure.
'Cause we're looking we had created at a previous salary board 6 part-time children and youth workers to assist with transportation and the backlog that we have through children and youth. The salary, the part-time salary was too low. So we're raising the salary to $35 an hour, and we're adding on another 6 for the total of 12 part-time workers. Again, just because we add them on to the complement doesn't mean we will fill all of those positions, but we've been in talks with the state on how we can collaboratively address our backlog. And they suggested we move in this direction. They're committed to providing the county with resources to cover these expenses. So this will just help us get the backlog down and then make sure we have enough people on the ground getting these cases taken care of.
Thank you.
Do you have on some of these positions, do you have people in mind? Anybody asking about these?
So we have had previous children and youth workers who have reached out saying that they would be happy to, on a part-time basis, work with the office to assist with the backlog. We're also going to throw it out to other children and youth offices across the county, but we would still need to have those folks hired part-time as county employees, even though they're employed by other counties. So that's why we had to do it this way. So yes, to answer your question, Commissioner, we have many individuals who are interested.
Good.
Barb, do you want to talk also now about the 2 other ones, the case managers and then the DUI coordinator?
Sure. So these are actually positions that are drug and alcohol related positions. So at a previous salary board, we had 3 case managers and a DUI coordinator that were added on to the Department of Health's seniority list because we obviously no longer have a Department of Health. There's still a need for those 3 positions, so we're simply moving them under the umbrella of Human Services, and they're budgeted for 100% through drug and alcohol. It won't cost the county any additional money. We're just moving them from the former Department of Health seniority list to Human Services.
Great.
And at this point, I don't know that we'll necessarily fill those positions right now, but they are included in the budget and are there should we need to fill them.
Okay, thank you.
Sure. Any other questions?
Any questions for Barb? Okay. Any additional comments on the question on this? Okay, I have a few comments. So today we're voting to take another major stride toward remaking the delivery of services for vulnerable children and families in Lackawanna County. The creation of these positions will help implement our innovative Family First Community Pathways program. This program will steer vulnerable families to the services that they need so that the Office of Youth and Family Services intervention will not be necessary in most cases. The objective, which we've talked about now quite frequently, is to keep families and children out of the child welfare system. These new positions make it possible for many of the former Department of Health personnel to apply their skills in mitigating the public health emergency inherent in conditions like poverty, domestic violence, substance abuse, illiteracy, and more that lead to the need for services from OIFS. Today's actions are just the latest manifestation of our ironclad commitment to resolving this crisis, not just for the sake of restoring our full license with the Office of Youth and Family Services, but for ensuring that every Lackawanna County family has the chance to succeed. As was just pointed out by Mrs. Durkin, there are major cost savings doing it this way compared to what the previous path that the county was on with the Department of Health. If we did nothing, if we didn't have this salary board today, we would still have this problem. We'd still have the problem of over 700 cases in a backlog. We'd still have all of the other problems that have been discussed with this agency. So the alternative to me is not acceptable, and that's why this plan, I think, is a good one and hopefully is going to lead us down the path of restoring the license and restoring the agency to what it once was. Anyone else? Okay, all those in favor of the motion signify by saying aye.
Aye.
Aye. Opposed? The ayes have it, and the motion has been approved. Motion 24-4029. This is a motion, or may I have a motion to create the position of program manager at a salary of $65,000?
Motion.
Second.
On the question, all those in favor signify by saying aye.
Aye.
Opposed? The ayes have it, and the motion is approved. Motion 24-4030. May I have a motion to create the position of community health nurse at a salary of $50,000?
Motion.
Second.
There's been a motion and a second on the question. All those in favor signify by saying aye.
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 Aye. Opposed? The ayes have it, and the motion has been approved. Motion 24-4031. May I have a motion to create 9 positions of community health navigators at a salary of $40,000?
Motion.
Second.
On the question, all those in favor signify by saying aye.
Aye.
Aye. Opposed? The ayes have it, and the motion has been approved. Motion 24-4032. May I have a motion to create 3 positions of case manager at a salary of $44,171?
Motion.
Second.
On the question, all those in favor signify by saying aye.
Aye.
Aye. Opposed? The ayes have it, and the motion has been approved. Motion 24-4033. May I have a motion to create the position of DUI coordinator at a salary of $52,000?
Motion.
Second.
On the question, all those in favor signify by saying aye.
Aye.
Aye. Opposed? The ayes have it, and the motion has been approved. Motion 24-4034. May I have a motion to increase the salary of the part-time youth and family service worker from $16 per hour to $35 per hour, and to create 6 additional positions of part-time youth and family workers at $35 an hour?
Motion.
Second.
On the question, all those in favor signify by saying aye.
Aye.
Aye. Opposed? The ayes have it, and the motion has been approved. Opportunity for the public to address the board. Seeing that there is no one, members other business, Commissioner McGloin.
Healthy families and kids aren't simply a government prerogative. They're the foundation of communities, and this effort calls on the entire community to help stabilize that foundation. We thank our dedicated staff, the Shapiro administration, the former Department of Health employees who are leading their expertise to this effort, and our community partners who are crucial to Community Pathways success.
Thank you. Commissioner Chermak, any comments?
Yeah, these are all very important positions. You know, I know we've been struggling with this for quite some time. I'm certain that raising some of these salaries, which they were so low, that it's awful, but I think this will certainly help with getting some new folks here and try to get this program underway and on track. You know, but the problem is, you know, as a county, we only have so many dollars to work with, so we're going to have to really buckle down in other departments and attack the structural deficit that we have so that we can continue with this important stuff and make sure that we can fund these positions and do the right thing here. So it's going to take a lot of work, like I said, in other departments, and I'll be happy to work alongside everyone and get that done.
Okay. Thank you. And I'd like to ask for a motion to adjourn.
Motion.
Second.
On the question, all those in favor signify by saying aye.
Aye.
Aye. Opposed? This meeting is adjourned. Thank you, everyone.